signify by stating aye.
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 And any opposed? Okay, the minutes of September 6th of 2023 are approved. Is there any public comment?
No public comment.
Okay. So the first consideration for action to be taken by the committee is 2024 citizen member nominations.
All right. Each year, we have two citizen member positions that are up for consideration, nominations, and approval by the council. We currently have Kathleen Etzbach. She is a UW Stout professor emeritus, so she has retired this past year. But she's still active in the community and is a provider. She runs a clinic out in the community. She would like to continue on with us as a citizen member. And then the other position is currently filled by Jamie Dardane. She's with the Bridge to Hope. She's a legal advocate. And she would also like to continue working with us for a second year. So those are kind of the short list of the citizen members. Typically, everybody else in the council is designated just by the sheer position that they hold. So these are the two positions that are really kind of ad hoc out there in the community. Essentially, the requirements is that somebody lives in Dunn County and then they have some kind of connection to the work that we do in the criminal justice system. And then are really willing to work with us and attend the meetings. So they're the nominations, I guess, that were that I have prepared to move forward. So I'll pause for discussion.
Sounds good to me. So
I'll move to accept the two named person as citizen members for the year 2024.
I'll second that.
Oh, get me to it.
any discussion on nominating those two for citizen members for 2024? Hearing none, I guess all those in favor of approving Kathleen Etzbach, I want to say it's Jamie Dardane from the Bridge, to serve for the 2024 citizen member, signify by stating aye.
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 Any opposed? Okay, it looks like we're good on that item. Next item is amendment of the bylaws to include the city administrator as a voting member. I guess I don't know if we said if it was going to be the mayor designee or if we wanted the citizen or city administrator, I guess.
Yeah, so we're circling this one back around. So last meeting, we did get the executive to approve the expanding the bylaws to include the mayor or designee. So the mayor would be more than happy to join our CJCC. So he should be there at our next meeting in October or October 12th. But as the vice chair and I were planning this meeting and really looking at the membership as far as the council, this seems like there would be more parity if we did have both the top elected official of the city and then the top executive of the city, which would essentially be the city administrator and the city mayor. So we're bringing that back around for consideration. Judge Meyer, anything that you'd like to add to the conversation?
No, but thank you, Sarah.
So I would go ahead and move to revise the bylaws to add the city administrator to the council.
And I will second chairperson's motion.
All those in favor of amending the bylaws to include the city administrator as a voting member for the large CJCC signify by stating aye.
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 Any opposed? Okay, that passes. And then the third would be a bylaw change regarding aligning the DCCJCC with the CJCC national standards. And I'll defer to Sarah on further information on that.
All right, so in the meeting packet, there was two pretty significant resources. It was the CJCC essential elements and then the national standards for criminal justice coordinating council. So these are recent documents that came out of the federal government as far as really how the best practices for operating a CJCC locally. So as you can see in the meeting packet, I kind of went through the different standards and boiled it down to essentially a one-page document that really covers the 13 standards that CJCCs should strive to meet. And then just proposed action plan. There are a couple of areas that we fall short and we could have some room for improvement. The first is that the CJCCs really should have a vision statement. So we have a mission statement. So in the attached bylaws, you'll see a proposed vision statement. You'll also see the second area we're falling short is a formal onboarding process. So we added some proposed language to the bylaws under the meetings or new membership area. Just really articulating a formal that I will offer a orientation. It's ultimately up to the individual whether they follow through with that or not. And then the third area for improvement really is a formal policy requiring members to abstain from voting if they have a conflict of interest when it comes to fiduciary matters. So if you've got a personal stake or a financial stake in the decisions that we're making, you really should abstain from voting. And I don't think we've ever entered that territory, but it really is a good standard to have in our bylaws. So those are the three areas that I'm proposing that we consider making some modifications to our bylaws. I put some proposed language in yellow in the draft that's in the packet. And then those are really up for the committee here to wordsmith, to approve, to reject, or just to throw the whole thing out, whatever you'd like to do. So I'll hand it back over to you, Andrea.
Okay, is there any discussion on? I guess we should probably have a motion to approve, and then we can have discussion on it. Is anyone prepared to make that motion yet or had the opportunity to review it from the packet?
I would move to approve the changes as presented.
I'd second that.
Okay, thank you. Any discussion on the proposed additions to the bylaws? To me, it looks, look like good changes, nothing too significant. So any other discussion on the changes to the bylaws?
Sarah did lots of work going through the national standards page by page and the essential elements, comparing it to ours, boiling it down for us. Hey, I really appreciate that she did all of that work.
I have a clarifying question with the abstaining from voting. There's financial or personal gain. I just want to make sure that that would be a personal gain versus a department gain, because many times we vote on grants that would assist the department and we would get that funding through the grants. So I just want to clarify that that's that I still would be voting on those types of things versus something personal.
Yes, you're 100% correct. It is a personal gain, not a departmental. If we had that, we wouldn't have much voting going on.
Right.
But
Just
yes,
wanted
and
clarity.
in the proposed language, it really does say a personal or fiduciary. Do we want to clarify that a little bit more? Or is that clear enough?
I think it's clear enough as long as we understand it. I just wanted to make sure because it kind of separated those two, personal and financial, and certainly there's financial gain for our departments.
We could change it to, instead of number 5, instead of it is expected that council members will abstain, we could change it to council members will abstain from voting when they have a personal gain or fiduciary conflict of interest. I mean, that might clear it. When I read it a second time, you know, because Sarah and I went through this, but is expected, that language should come out.
Okay, so just to recap what you said, council members will abstain from voting when they have a personal gain or fiduciary conflict of interest. Better?
Yeah, I'd move to amend the motion to that language.
I'll second that amendment. Okay, any further discussion? Okay, hearing none. All those in favor of amending the bylaws to align with the national standard as outlined in the meeting packet, please signify by stating aye.
Just a,
Aye.
I was gonna say, just a point of order, do we need to vote on the amendment to the amendment before we vote on the amendment?
Technically, we probably should.
I guess all those in favor of amending the bylaws as Judge Peterson outlined, signify by stating aye.
All right.
Aye.
And now, all those in favor of amending the bylaw changes as just approved as well as outlined in the packet, please signify by stating aye.
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 Any opposed? Okay. I think our next item is the agenda planning for that'll be our last large meeting before the end of the year for October 12th. Sarah included a proposed agenda in the packet. Any discussion or additions, changes anyone would like to see for the agenda?
Just I'll add in the actions that you just approved. As far as the city administrator, I'll add that in, and then the names of the citizen members that you just nominated as well.
Looks like we will have a busy meeting. Anything else on that item? Okay. Next item is our educational component, and thankfully Paula's here to give us a little update.
No. Are you seeing a Zoom meeting or are you seeing my PowerPoint?
We've got your PowerPoint up.
Oh, good. Okay, thank you. It went to my third screen. So all right, so thank you for inviting me to the meeting to talk a little bit today about human services updates that connect with CJCC. The first one I wanted to update with you is the drug endangered children. As you may remember, this was taken from having a separate committee to me providing updates once in a while as to how DEC is going for our department. So this is the update on that. So when a new referral comes in for child protection, it is screened either in or out for investigation or what we call initial assessment. And if there's drug information with that would cause the impact that law enforcement would need to go along, we notify law enforcement right away so that we can begin that DEC procedure and process and notification with that, and law enforcement then are looped in, go out and complete the investigation. along with any other parties that we need to include. So in DEC, of course, there's things like if school needs to be notified, we connect with schools and let them know, what's going on, if there's any concerns, any placements, all of those kinds of things, medical or others that would be needed within that initial assessment and what we call the DEC case. So first of all, that's what happens. Secondly, as part of the DEC process, we do then meet on a monthly basis with team collaboration. And there's already a forum to do this that's called an investigators meeting, where my staff and the law enforcement jurisdictions come together. And then if there's any DEC cases that need to be reviewed, or the process, something went wrong, something went well, they talk about it there and then can make those tweaks, right as they're talking together with it, so that it's not waiting for like 6 months for a meeting or something like that. It can be happening kind of on the spot as changes need to be made or reflections. And then, so those have been occurring, going well. I've not heard any issues with DEC or from law enforcement or other outside agencies or from my staff. So that's great news. And I just also wanted to share in here that when we receive a screened-in report of child protection with a child that's part of the family, that would be part of that system, and they're under 3, we share that child protection report with our Birth to 3 team as well. And that can do 2 things. Number one, they might be in there ready for something, and it can create awareness for their own safety or the child's safety, family safety, with information to drug issues. Or else when we are investigating that underneath our initial assessment, as we call it, that if there's any child with disabilities, we can then make referrals, or at the end of that 60 days, there's an automatic referral if that investigation is found substantiated. So then they kind of have the information ready and to go out and meet with families as well. So just kind of wanted you to know the collaboration that's also happening in our department with Birth to 3 as well as law enforcement. Just kind of keeping everybody in the loop, because we have multiple factors, the family safety, worker safety, all different kinds of things that are going on there with that. Any questions on drug endangered children process? Okay, and I'm going to move on to youth justice. In 2023, so far, we've had 61 referrals for delinquency and 29 for truancy. It's typical that in the next month or so, we're going to start seeing an incline in that, because according to the truancy regulations, they have to have so many absences. The school has to meet with parents, put all of these things in place before sending a truancy referral. And so we, with school just starting a month ago, it takes some time for that to happen if we're starting to see some truancy patterns with the youth. And then I just also gave you the data for 2023, or I'm sorry, that should say 2022 data, 51 truancy, 71 delinquency, and 4 civil law violations. So you can kind of tell where we are compared to last year in 2022. Truancy court, which Judge Mayer can probably talk a lot more about than I can, but I'm going to give it a shot, Judge. So according to my staff, truancy court is run very well. There hasn't been kinks or anything like that. They've been moving forward. Happy and feeling like families and youth are really getting a lot out of the truancy court. In the past, we have had truancy court referrals for the older youth. And in 2023, we opened it up to a younger elementary children, but this is really working with parents, right? We're not expecting a 5-year-old to get themselves to school, right? So we're working with parents to say, can we help reduce barriers or those kinds of things going on within families, so that this pattern doesn't continue, throughout the child's life in school. Oops. I went too fast. Sorry about that. Go back one more. Yep. So then Yazi is the other piece. I should back up. It's been too short of a time to really know pros and cons of this. So we're going to continue to evaluate if that's working or not. And we can let you know in the future. Judge, is there anything you wanted to add to truancy court?
We just had some children that were elementary school children that were from last year. So we went through the truancy process with their parents. The children are not welcome at court. That's on the notice of hearing. Children aren't welcome, those little ones. But they just came back for a review this week. And the mother told us that those 3 children, they're going to school, they're getting on the bus, and they like school now. So little anecdotal, one family type of thing, but if that works and we can get the parents to get the kids to school and parents tell the children they have to go, then maybe they'll like school.
100% success. Great job.
Thank you.
Yeah, yeah. All right, and then we have the YAZI, which is the Youth Assessment Instrument Screening Tool, and this was implemented a couple of years ago across the state of Wisconsin. Lots of training done on it with that tool to be able to work with youth to really assess what's going on. You know, we're getting to the root causes of things versus the surface. There was a delinquent act or something like that. We're really digging down. Why is that? What's going on? What's going on in the family? What's happening with the youth? Is there any mental health, substance abuse service or needs? Those kinds of things. And so we are doing that, and it's going very well. The staff really like the tool, and Jenna Gintner is kind of our lead on that tool. She has taken on as a trainer with the tool, and she's also helped out with other counties during times of shortage and also in training the tool. So we've got a agency expert right here that's helping others. So that's wonderful. It's going well. All right, and then when we look at the youth justice as well, we're also looking at what is our connection with the school system. And we wrote a grant, I think it was back in 2019, 2019, to help cover this program in our schools. And it is currently in Menominee, Boyceville, and Elk Mound schools. In just the first half of 2023, we did serve 76 youth in that end of the school year time period. The goal of the group is to provide middle school students with drug prevention programming and opportunities to learn new skills like leadership, public speaking, while making a positive impact in their communities. We also provide that opportunity for them to have an after-school snack, make new friends, spend time with the old ones in a safe, positive environment. So those social connections that we know, especially, you know, in the wake of COVID, where there was a lot of online communication, still is with kids, right? Youth, that's a lot of it's happening electronically on their phones or systems. It's important we teach youth how to interact with others, right? So that's occurring in the after school program. They've also participated in activities like creating educational flyers, information videos, practicing drug prevention skits to perform to the elementary students to really help drive in that education and transfer of learning from themselves to others as part of this work. And the staff is happy to be back in person programming again this fall. Sorry about that. Of course, that goes off right now. They are using evidence-based program developed by the Dover Youth to Youth program since it was launched. And I got this from Kathy Asper because it's really Arbor Place that runs this program. We take that grant money and transfer it to Arbor Place, and then they do the work, you know, in the field with it. And so Kathy Asper has kind of been the lead of that program for these years out of Arbor Place. So she did provide a link as well, and I can send that out if people are interested in that. Any questions on the after school programming with the AODA work? That's the one that we're really involved in as far as paying, and I'm sure there's a lot of good other education going on in schools, but this is the one that we are connected with.
Paula, I had a question, if you don't mind. Back where you were talking about the referrals for delinquency and truancy, when you say delinquency, what are they delinquent on?
Sure. So any crime that would occur as an adult, that is called a delinquency. So if you had a burglary, you, it's not a traffic citation, but it is a true crime, that they might have, done, drugs, possession of drugs, anything that would be a crime as an adult, and you have to be 10 to the age of 17 for that. And then anything over 17 goes to the adult court. Anything under 10, usually if there's those kinds of behaviors, we address it in the child protection realm, because usually it's, there's some mental health needs, substance abuse needs, or there's some parenting practices, that might be going on that needs to be part of that. And so the state law says 10 through 17 is delinquency. Really
Okay.
great question. Thank you.
Thank you.
Mhm. Then if we look at the adult protection services, I was also asked to speak a little bit on that. When we talk about adult protection, that is elder abuse, which can be anybody that's an adult, or it can be our aging population, some of the older. And so there's differences in probably what we investigate or work with for those two different populations. When we're looking at adults, it could be somebody that doesn't have the capacity to take care of themselves, or the understanding or abilities to be able to do that. And so they might need a guardianship. They might need to be protectively placed. They may need services to help them with their daily living skills, those kinds of things as an adult. So there's like that portion of it, and we can get reports of, somebody neglecting their own health and safety, living in situations that are not healthy due to, poverty, mental health, substance abuse, those kinds of things, not having natural supports, as well as our aging population. And so we're seeing, the dementia and other physical issues going on with people, usually in that adult protection stage of the older person. Of course, if you have a developmental disability or a mental health issue or a substance abuse, they don't just automatically turn off when you are 60 years old. They continue to follow you, right? So a lot of these people are the same people that we might work with in our mental health programming or those kinds of things. So, and I'll talk about that just in a couple minutes here. So I did put in here on the PowerPoint that we have 2 current staff, and we also have 1 supervisor that's in our Aging and Disability Resource Center that supervises that program, and those 2 staff. And I'm going to talk a little bit about changes coming up with that in a minute. The types of cases, again, are investigations, guardianships, protective placement services. So we're not only just working with the individuals, we're working with their families, the community, the courts, our corporation council. If there's needing to be a protective placement or guardianship, we're working with attorneys. The individual may have an attorney, and we're also working with medical facilities, because a lot of times they are placed in the hospital or those kinds of things. If the emergency comes up, that's how we're made aware of a lot of time what's going on. And then we work with those facilities to determine if they can go back in the community or not. So that's, some of the work they do. We did just receive an elder abuse awareness grant that I wanted just to let you know, and that's with DOJ. We applied for that and did receive that. That will start January 1st. So we'll be doing some educational campaigns about APS and trying to just really help the community understand it. And so that we're receiving those referrals for people before it becomes such a challenging situation, right? So so that people kind of know what's out there and how we can help them with that. And then lastly, I wanted to talk about changes to the unit on this slide. What we're doing now is we are in the process for 2024 to move our adult protection unit over into our behavioral health unit out of the ADRC. And the reason we're doing that is because the cases have become so much more complex than they have in the past. We're just seeing those mental health, substance abuse, issues intertwined with adult protection, and really feel like that collaboration and teamwork can be even increased if they are in a same unit together versus two units trying to work together. Not that they don't do well, but we just really want to excel that even higher, to be able to give that wraparound service so the consumer doesn't even know which unit it is that's, you know, responding to them, and, you know, type of thing. So in addition, there is a little bit of funding that can come with billing for the mental health side if there's a crisis in the beginning. And so our adult protection workers can be trained, and we can receive a little bit of funding in that as well. Some of you may already be aware that there's hardly any funding from the state in adult protection services. And we have asked for an additional worker in the 2024 budget. And if it's granted, that position will be a lead worker with APS. And I'll show you the reasons why we need that in just a second here. Let's move my slide. So when we look at time from 2017 to 2022, you can see the numbers. You know, we're looking at 86 cases in 2016, and we're looking at 268 cases in 2022. In 2023, from 2022, we are now at 290 cases, and that is of today, compared to last year at 203 for the whole year. So you can see these numbers continue to escalate up in the case assignment. So, and you know, this is just a slide about the baby boomers. We're all aware of that, but when you see this, you know, movement going up, that's the reason for the referrals. As you continue to get more older persons in our community, they're needing more assistance, right? And so that's what's creating this, is those number of baby boomers moving up into that stage. Yep, this is a little bit of the complexity. So I talked a little bit about the co-occurring mental health and substance abuse factors. The time that we're involved in cases is so much, has increased so much. It's not just like a couple visits, let's get things set up for you, make some referrals. We are been involved in cases for months upon months because of the need for services and work with that. I should also mention the other piece that's not only the baby boomer piece, but the scamming issue. That, you know, there's been so many more scams on older persons. And so we also work with people who, you know, have been involved in scamming and trying to help them, you know, out of the situation that they've gotten themselves in and those things. And those can take a long time working with the banks and law enforcement and all of that to try to handle those situations. So the length of involvement in there, I don't have a case example for you today. So yeah, I think that's kind of where I wanted to bring you to. You can see the need for the additional staff person there that we're asking for from the board with that. So with that said, I'm going to stop sharing and ask you if you have any questions on those areas or anything else. No, thank you for your time and your interest in what we do here.
Yeah, thank you, Paula. That's a lot to cover for one department. So I really appreciate that and having that PowerPoint. I guess, are there any local challenges, collaborations, or priorities anyone would like to share? Okay. Hearing none, the next item is emerging trends and opportunities. I think Sarah sent out some information about fentanyl overdoses.
Yeah, and I'll just take a minute here. I'm going to share a screen and share the chart that was in that article. And this really is just a recent article. Can you see my screen? It's interesting. You can't see it when you're presenting, but hopefully you can see a PowerPoint. This is out of some research out of UCLA. And what they're finding is that the proportion of deaths related to overdoses that have stimulants laced with fentanyl has increased. So that's what they're talking about, this 50 times increase. typically, historically, methamphetamine, it's a caustic drug, so it can, do a lot of damage, but the overdose, it wasn't quite equated to an overdose. You might have a heart attack, you could have a stroke, you could have infections, all sorts of, not good health outcomes from stimulant use, but it wasn't necessarily associated with overdose. That's changed because the stimulants that are out there often do have fentanyl in it. So that's what this chart is really alluding to. The number of overdoses with heroin's gone down, with prescription pills has gone down, but not with fentanyl. And then when we're talking about stimulants, it's getting contaminated with fentanyl. So this was just a real short article, but I think it hit home on the change of the deadliness of the drug supply that's out there. A lot of things start at the West Coast and kind of move their way over. So this is UCLA research. But it's certainly something that we're hearing more and more about, is just that fentanyl, the deadliness of it, and it can be mixed in with other types of drugs, and then people don't know what they're consuming, and that's how they can get into an overdose situation unknowingly. So any questions on that piece? All right, that was just the gist of it. So thank you.
Okay, agency reports. I'm not sure what that is. Is that it's not your staff report? It's
No,
something
just opportunity for others to make any updates that they'd like to share with the group.
okay. Next item is the staff report. Anything to add to your written report, Sarah?
Nothing to add.
Okay, and then the next meeting dates are October 12th. That's our large group in person. But if you need to appear by Zoom, you can. And then our next executive and operations is November 1st at 11. Special thank you to Judge Meyer and Sarah for putting together this agenda, as I wasn't able to meet for today. And thank you again, Paula, for taking the time to talk to us. It's very interesting. All right, everyone have a good day. Unless you want to, do you want to vote on adjourning? All those in favor of adjourning, wave goodbye.
Goodbye.
All right, bye.
Have a good day.
Bye-bye.
Arrivederci.